What helps people more, charity or capitalism?
I think the two can be connected.
Right, where there's a real free market, no government privileges, capitalism does wonders for people, often more than charity, certainly more than big government. The premise of Obamacare is that government must guarantee health insurance, but health insurance isn't great. It distorts markets. It raises prices. Fortunately, some medical clinics don't take health insurance. I sent producer Ricky Ratliff to check one out in Oklahoma.
Dr. Smith, 620.
Dr. Keith Smith runs the Surgery Center of Oklahoma, a private surgery clinic that posts its prices online.
In the waiting room, you look at the menu and go, okay.
We don't really get a healthcare menu in other places.
Yeah, to know going in that everything is covered, and parenthetically, I didn't have to pay for a $100 aspirin. Isn't that cool?
He had shoulder surgery that cost $6,000. It would have cost 5 times that at the hospital. Of course, often people can't even find out what the hospital will charge.
We actually couldn't even get a price quote from other hospitals. We would call and they just looked at us with a blank stare. No one would even give us a price. One day over the phone, someone gave us a quote of around $15,000, and the price for this surgery here was a third of that.
Ayer needed his bicep reattached after a canoeing accident. He and his partner drove from New Hampshire to have the surgery here.
It was still cheaper for us to pick up and move and pay rent here in Oklahoma City for 2 months and pay for cabs and buses than it would have been to stay back in New Hampshire and get surgery there.
Luke Carter needed a knee replacement. After researching prices for 40 hours, he found one hospital that wanted a $26,000 deposit.
There wasn't another facility in the city or state that would even call me back and give me a price.
Dr. Smith charged less than $8,000 for both knees. A hospital told Linda Combs removing her gallbladder would cost $22,000.
This was a fifth of the cost.
The founder of that clinic, Dr. Keith Smith, joins us now. You must cut corners to be so much cheaper.
Now, I always like to hear that, because the prices you see on our website are actually what it costs to take care of patients. And that's one of the big lies that we've all been told and many believe, is that healthcare is very expensive when it really doesn't cost that much.
But how can you do knee replacements for 2 knees for $7,000 when the hospital is charging $50,000?
Well, they've got to come up with the money for all these extracurricular activities somewhere.
And the paperwork and massaging the government, and they pay their people more? Do you have a higher infection rate?
We actually have a almost non-existent infection rate that we publish online. High prices indicate a lack of competition. Low prices, if anything, indicate the presence of healthy competition.
When you first opened, you were surprised that many of your first patients were not from Oklahoma, they were from Canada.
Yeah, the first people who actually showed up, the first patients when we put our prices online, almost 6 years ago, were Canadians. They had health coverage, but they didn't have care, and coverage doesn't mean care, and they found that out the hard way.
And on the phone, you told us when government gets involved, those charged with delivering care line their own pockets. What do you mean?
When government gets involved to ostensibly help the poor very seldom are the ones who are the beneficiary of that government program. It's usually somebody like a big hospital where the folks are just lining their pockets with all of this money. Our prices that we have listed online are actually less than what Medicaid, for instance, pays these big hospitals. So there's a lot of money to be made from these government programs that supposedly take care of the poor and their health care.
And now that you've done this, instead of we don't take insurance, we post prices. 5 other places near you began posting prices.
Yeah, there's so many now. We formed a national association. There's over 200 members of an outfit called the Free Market Medical Association. These facilities are popping up all over the country, embracing the wisdom of the free market and applying that discipline to their own practice model.
Well, thank you, Dr. Smith. Coming up, where I give my charity money. Hope they don't squander it.